at Anacapa Dental Art Institute, we do end up replacing a lot of veneers that had been done previously. Why does that happen? Sometimes the patient's in the chair, the provider's, about to put the veneers in, the patient feels under pressure, the dentist wants to put the veneers in, and they put them in, and the patient looks in the mirror and they just don't like what they see. Unfortunately, we have to replace a lot of veneers. Now, what technologies do we have to be able to provide a result that is predictable? First and foremost, we do have lasers to remove veneers. No longer do we have to drill the veneer off and take hours on end removing a veneer. Within 45 seconds, we can use a laser and literally pop the veneers off. I always tell patients that we try to begin with the end in mind. So for example, if a patient comes to see us for porcelain veneers, the first thing I sit down and I ask them, I said, what is it exactly that you're unhappy with? Is it the shape, the length, the color? What is it exactly that you would like us to accomplish? And we listen very, very closely. It could be that they want their teeth to look like a particular celebrity. And we can do that, but I always tell the patient that these teeth have to look right on you. So we begin with the end in mind. What does that mean? We have digital technology whereby we can scan the patient's mouth and digitally fabricate veneers outside the mouth. We provide the patient a preview. The way we provide them a preview is not through digital imaging on photographs. Digital imaging on photographs, in my humble opinion, is very misleading. We give them a physical representation directly in their mouth. We do something called a mock-up. So without touching the teeth, we provide them with temporary veneers which we press directly onto their teeth. We bring in their significant other and we show them. And we show them in a mirror, we take photographs, we do video capture, show them their dynamic smile so that they can see exactly where they're headed. Now comes the day where we have to prepare the teeth very minimally invasively for the veneers. And a lot of the times we don't even use anesthesia. We're not really removing that much tooth structure from their tooth. We scan their mouth and we provide them with the temporary veneers. They get to live with them for 4 to 6 weeks and get feedback. And once they've received their feedback, we change the veneers or the temporary veneers from a patient perspective, from their needs. And once they're happy with it, we duplicate that in porcelain. And the day we put the porcelain veneers in and we finally bond them should be a very predictable day. The patient should look in the mouth and say, hey, I love these.